inviting me to talk a little while today about my favorite topic, which is indeed sort of everything that has to do with a clinical approach to chronic diarrhea. And as you can see in the little subtitle here, we're going to focus mostly in this webinar on chronic non-infectious diseases in dogs. I just thought I'd start with a little picture of what Scotland, where I am currently, looks like. So this is just the heather as it is in full bloom, you know, to maybe start with something quite visibly nice. And this is what it's going to look like soon. So that gives you a little bit of an idea of where I currently am. And from this, we're going to pretty much straight away go into what I call the acronym jungle. And I think it is sometimes quite hard to keep track of all the different acronyms and abbreviations that are used when it comes to diseases of the gut and anything that can cause chronic diarrhea or generally chronic gastrointestinal signs. So what I'm hoping to do is, while we're going along, to not only talk about the clinical approach and in the end, we're also going to talk quite a bit about treatment, both the sort of traditional treatment approaches as well as maybe the novel things that are out there and are sort of currently what we're trying to change, but also hopefully, you know, put a little bit more order in this sort of jungle so that we all have hopefully a same idea of what we're talking about when we're discussing these kinds of cases. And I think probably most people would be pretty familiar with the term inflammatory bowel disease, and this is what has been used for a long period of time already. But in recent years, or maybe in the last 10 years or so, more and more we have been actually using terms like chronic enteropathy or even chronic inflammatory enteropathy. And it seems that all of these terms mean slightly different things to different people. I'm just going to give you sort of my definition of these terms. And then, of course, we have all, as I said, all these multiple acronyms that we use that sort of fit in one or some of these categories. And you know, I'm going to go into most of those to a certain extent during this webinar. Let me just get my little pointer going as well. I hope you can see that. So, for example, I think probably most people will be fairly familiar with food responsive enteropathy, or even maybe protein losing enteropathy or PLE, and then maybe more old-fashioned terms like small intestinal bacterial overgrowth and so on. And so, as I said, hopefully I'm going to paint a little bit of a picture for you so that you can fit these into a proper order when it comes to making the diagnosis and how to treat them. And the way I like to do that is to maybe take these three cases of dogs that were all presented with different variations of the same theme as an example to showcase basically the sort of workup as we are currently doing that in the sort of tertiary referral hospital that I am working in. But hopefully it will be applicable, you know, even if you're seeing these cases sort of in primary care clinicians. So you can see here's Bella, a relatively young Shih Tzu, had diarrhea on and off since in the owner's possession, has also always had some itchy skin issues, probably a very familiar tale for most of you. Then we've got Peter Parker, he is also sort of not well for a large breed, maybe sort of medium age hoverwort, and he had diarrhea again on and off, but for a little bit of a shorter period, about 4 months. Still, that would obviously classified as chronic. And then we've got Angus here, who is the oldest of the three. He's 12 years old, and he has 3 weeks of vomiting and diarrhea. So that just about is the threshold of where we talk about chronicity, so chronic diarrhea. And as it is so often, at least in sort of my hands in these cases, the one thing these dogs have in common is that they have a physical examination that is pretty unremarkable. So there's nothing that immediately sort of jumps at you and you think, I found this big abdominal mass, or, you know, something where you think, oh, this dog really has a poor body condition score, so something potentially more serious has to be going on. So there's nothing really to give you a hint where the problem might actually lie. And that is then usually where the sort of decision trees or algorithms come into play. And this is just how my brain works and how I think about differential diagnosis, and I hope that that is not sort of too alien to you and your way of thinking. So I always think about all the sort of clinical problems in the same type of algorithm, and so I also do that with chronic GI signs or diarrhea. But I always think, you know, obviously apart from the fact that it could be a congenital versus acquired, which of course a majority of cases that we see it is an acquired condition, and following on from that, we're thinking about maybe non-infectious versus infectious. When I talk to my students, they always seem to remember the infectious causes they seem to remember them better than the non-infectious ones, even though I would say that overall in chronic diarrhea anyway, the infectious causes in dogs may be a little bit less frequent than the non-infectious ones. But we have to think about some, and I'm not going to lose an awful lot of time talking about those, and I'm also obviously aware that there might be quite a number of geographical differences here. So depending on where you are in the world listening to this, obviously you might have different pathogens. And in a way, in the United Kingdom, we are quite lucky because there aren't actually very many pathogens that come into place here. So I think viral, we can probably, for a chronic problem, we can all exclude. There isn't anything that would cause that in dogs. Here, as I said, in the UK, we don't have any systemic fungal or algae amoebid type infections, so we don't often investigate those. So that leaves us as the most common causes often with parasitic or bacterial. And I've put a little question mark here with bacterial because I am one of those firm believers that actually there aren't that many true primary bacterial pathogens in dogs. And if you find some, they are often a little bit of a red herring and actually distract you from what is really the underlying cause. But we come to that in a second. And then here on the non-infectious side, I often then think about it could be within the GI tract or it could be outside the GI tract. And this is often where, you know, again, students or newly grads get a little bit confused because they think the list is so incredibly long. Where do I even start to think about possible differential diagnosis here? And I'm always thinking, actually, it isn't. It is just 4 organ systems really outside the GI tract that you have to think about that could cause this, which is the liver, the pancreas, the kidney, and potentially the endocrinium. And if we think about especially the latter, really only 1 or 2 diseases, like for example hypoadrenocorticism or Addison's disease, that can mimic these sort of chronic enteropathy signs to think about. And if you stay in these broad categories, you probably have thought about the majority of it. Within the GI tract, inflammatory or neoplastic diseases are the top 2, but obviously we cannot forget that there are some that maybe not quite immediately coming to mind because they are a little bit rarer and they're more often associated with acute or subacute clinical signs. For example, chronic foreign bodies, intussusceptions, especially in young animals, or sometimes in combination with infectious diseases, or functional ileus that can have a plethora of different causes. So that is literally the sort of thing that every time I get presented with one of those chronic GI cases is the list of things I'd like to tick off to make sure that we haven't missed anything. And we're going to talk about, when we would be doing what and in which order just in a moment. I'd just like to talk again about these sort of infectious causes very briefly. And one of my colleagues from Germany, where I'm actually originally from, kindly gave me this slide just to remind us that fecal culture is actually really not a very good tool. Because there's a lot of bacteria that we can culture from normal dogs and cats fecal samples, some of which sound pretty pathogenic to us in the first instance, but they don't have to be. But also I put this here just as a reminder, and again, we probably come to that again in just a moment, that the majority of what actually lives in the gut cannot be cultured. And some reports say that you can probably only culture about 20%, and everything else is lost to these sort of, in inverted commas, old-fashioned techniques of looking at the bacterial flora.